I'm Tom Ricketts. I'm a professor at the UNC Gillings School of Global Public Health and co-director of the American College of Surgeons Health Policy Research Institute. We've recently finished some work on the migration or movement of physicians and surgeons from place to place, and we've been studying the workforce supply in rural places across the United States. We have been looking at the movement of surgeons over time, as well as movement of physicians, by building a fairly unique database which identifies individual practitioners, all physicians in the United States, and links them over time from 1981 to 2006. I'm going to focus on some data for the 10-year period, 1996 to 2006. And what we found is that a surprisingly large number of physicians will move on in any given 10-year period. We looked at 5-year periods as well, but surgeons actually move more often than other practitioners. 32% of all surgeons will make a move. That is, surgeons in established practice. Now, when I say established practice, I'm talking about a practice after they've been in training. 80% of surgeons who are in residency will move to another county, but 32% of physicians, or for 32% of surgeons who are in an established practice, will move over a 10-year period. Now, they're moving in a pattern that you can see from this map that shows net movement of surgeons, that more surgeons move out of Pennsylvania, New York, Ohio, Illinois than move in, and more people move into Arizona and Florida than move out. These are net movements. What this does is it really masks some of the patterns of movement. We were really concerned with understanding the relationship of migration to the economic characteristics of the place where people went from and where they went to. We were trying to understand whether people were going into more or less competitive places. In our larger study of all physicians, we found that primary care physicians in general would go to places where there was less competition, but we found that surgeons would move to places where there was slightly more competition. That is, there were more physicians per population. But they also moved to places where there was lower unemployment, there was less poverty. Now, these movements indicate some reaction both to economic considerations on the part of the physician, as well as to a need to fulfill their professional desires and to meet needs of the patients that they would see. These were not trivial moves. These were not just to the next county, to a suburban county. The average move was about 550 miles. We found that women were more likely to move, 20% more likely than males. We also found that the most mobile group among surgeons was obstetrician gynecologists. They moved far more often than any other group. General surgeons were in the middle range of this. This pattern indicated that there was a slightly different reaction to the conditions that a surgeon was going toward. In other words, they weren't necessarily looking for a better income potential. That is, the competition was going to be slightly greater. They were really looking probably to find a place that was a little bit more amenable to the kind of practice that they were providing. So it's hard to actually understand individuals' perceptions, but in net, it appeared that folks were looking for better practice conditions, but not necessarily less competition. They were not necessarily maximizing income. So this is an interesting and contrasting result from what we found among all physicians. Dr. Zuckerman talked about the lack of surgeons in certain rural areas. We did this at the county level and characterized counties. So we found that some people were actually moving away from places that they were the last surgeon out the door, to where there are now 1,700 or 16, well, rather 1,168 counties that have no surgeon. He spoke of hospital service areas, but to put it in the language of counties, almost a third or slightly more than a third of all U.S. counties have no surgeon. Now, if you put it at that level, that it seems to be an appropriate level of access to surgeons at 6 per 100,000, 1,778, more than half of all U.S. counties, have less than an adequate supply of surgeons. And this is a population in the order of 32 million people. This means that these counties have hospitals. Some 600 of these counties have hospitals, but no surgeon lives or practices full-time in those counties. That means that the on-call arrangement for that hospital is going to be handled by either a primary care practitioner, or is there a person who's going to have to travel some distance to manage the on-call coverage of the hospital. That produces stress in practice and also makes it difficult for the hospital to provide the services that are necessary. But the bottom line is that surgeons are able to move, practitioners, physicians of all kinds are able to move, and they're going to respond to changes in the economy. Thus, if a community, a rural community or an urban community has its economy go in the tank or suffer a downturn, surgeons can move and are moving. And they're probably going to be forced to move away from places where they cannot make a living to places where they can. In those places, it appears to be not necessarily the places where they would be maximizing income, but places where they are just able to make a living.